Hello everyone, my name is Jon Cheek. It's 3 o'clock, so let's get started right away. Thank you for joining us. Excellent numbers again, so it's wonderful to see so many people that are joining this event. Quick introduction from me first. This is a UniTaster Tuesday event. So basically every Tuesday at UniTasterDays we run two types of events. We've got a general series of events which start at 12 o'clock until 1 o'clock. That's where we look at very general subjects in university education. So guidance. So that could be student fees and finance, personal statements, why to consider university, etc. In addition to that, we're also running a brilliant subject series events as well. The subject series events is where you find out more about studying particular subjects, and this is the first in that series. So we're starting today with medicine, health and social care. I'm absolutely delighted to introduce our speakers today. So joining us, we have got and I'll introduce the panelists in order of when they'll be speaking. We've got Steph Hartley from the University of Southampton. She's going to open things up and do 15 minutes for us, looking at essentially medicine as a subject, and linked to that the motivations for studying it, what to expect in the course. Then we're going to move on to Dr. Nicola Phillips, who's the admissions tutor at Lancaster University, and Nicola's going to talk about applications in terms of medicine. And then last but certainly no means by least, Hollie Thompson from the University of Gloucestershire is going to do a session looking at health and social care and courses and careers in those subjects. If I just introduce a couple more things first from this side in terms of logistics, and then I'll pass on to our first speaker if that's okay. So other things to let you know about is we have a Q&A running. I'm expecting, looking at the number of people that we've got watching this, the Q&A is going to be very, very popular. As a result, we'll do our best to answer as many of your questions as possible, but do send your Q&A questions, and then when we answer them, they go live for you, and we'll do our best to get through as many of them as possible. If you've got other plans later on, we started today at 3 o'clock. We'll certainly finish by 4 o'clock. So if you're making plans for the rest of your day, this session will certainly finish by 4 o'clock. And I think from this side, I'm not going to take much more of your time up in that sense. I'm going to introduce our first speaker straight away. So if I can introduce Steph Hartley. Steph is a recruitment and outreach officer at the University of Southampton. And Steph is going to talk about studying medicine and the motivations for doing so. So Steph, without further ado, if I can pass the floor to you, please.
So, as mentioned before, my name is Steph Hartley. I'm part of the Southampton recruitment and sort of outreach team. And what I'm going to do in this sort of session, as Jon mentioned, is just sort of go through pretty much the kind of, motivations for wanting to study medicine, and also a little bit about what you might be studying. A lot of students aren't really aware that there's a few different types of medicine course really out there. They just think doing a medicine degree is, yep, you've got your medicine degree, that's absolutely fine, well done, but there's quite a lot of different processes in there. So that's what we're going to talk through today. So there's a few different pathways to, become a doctor. And I think a lot of students kind of just say they want to be a doctor, but they don't kind of look at the general pathways or any sort of alternatives. So how do you actually become a doctor? Well, there's quite a lot more to it than just studying a medicine degree. So you've got your undergraduate education, so that's your basic medical education. Now, you guys are probably at that stage at the moment. So you're kind of looking into your basic medical education, that kind of BS, BM, MB, CHB, MBB. It's a lot of different letters, and I do understand that, but it basically is just your undergraduate, your first medical teaching, so your first kind of foray into medicine. And that's your kind of number one thing that you need to be doing. Now, when you finish that basic medical education, unfortunately at that point, you're, kind of a doctor, kind of not. You're not finished in a sense. You're not completely done at that point. So there's a little bit more that needs to be done after that. So you can obviously see an FY1, so Foundation 1 and Foundation 2. So what these are is every single medical student goes through this when they're finished their medicine teaching, and these are your training years in a hospital. So there's no more sort of studying at university. You've graduated, you've finished at uni, and now you're kind of in the hospital setting, and it's a paid employment, so it's not kind of a voluntary program or anything like that. These are the kind of years when really you are honing in on those skills that you've learned at university, and you're kind of on your own. You are an independent, you're continuing your training basically. And at that point, these are kind of when you might want to maybe decide if you have sort of a specialism in mind, if you've maybe wanted to become a paediatrician or, you know, a surgeon or a GP. At this kind of point, this is when you're going to be deciding and applying for those kind of different programs. So that's your kind of your postgraduate training to become your specialist, so those specialist areas. And then you've also got continuing professional development, because it's really, really important. And one of the most important things is to remember that you are never going to stop learning, unfortunately, with a career in medicine, completing these degrees and, you know, going into a career in medicine. That's it, you are essentially in a lifelong learning position. So, you know, for most of you, hopefully that's a really exciting process, that's a really exciting prospect, you know, always learning, always developing, but for some of you, you might not necessarily have realised that. So it's a really good thing to know before you kind of start your journey into medicine. And when I say journey, I mean journey, because it is quite a process to kind of get there in terms of sort of years of training. So as you can see by this diagram, you've obviously got your undergraduate medical training, the F1 and F2, the foundation years that I mentioned. Then if you're kind of thinking about maybe becoming a specialist, that can take sort of maybe up to 7 or 8 years. And there is quite a lot of competition to become those kind of more specialist posts. So it's really, really, really important that you kind of consider the amount of years that it's going to take you essentially to kind of get to those. And then also I've kind of put at the end there your completion of training, but also that kind of continuing professional development as well. There's always going to be new technology, there's going to be sort of new processes, new clinical skills that you need to kind of know, new research. Some of you might be interested in going into that field, for example, of doing the kind of medical research, in which case, you know, that's fantastic, but it's going to take up all this kind of extra time. So this is the kind of general journey. Some of you will be sat there thinking, yeah, that's absolutely fantastic, knew that already, wonderful. But for some of you, this kind of might come as a shock, you know, when they say, oh, it's a long process, it's a 5-year course. It's a lot more than a 5-year course. Now, we do use the example of training as a GP because everyone knows what a GP does essentially. You know, we've all probably seen one before, we've all interacted with a GP. So, you know, GPs are very accessible. You know, they're kind of on that front line really. If you have an issue, your first port of call really is normally a GP. And this is the kind of training process really. So obviously after your A-levels, you've got a medical degree of between 4 and 6 years. I'm going to talk in a little bit just about the different years and what that kind of means in terms of actual undergraduate degree lengths. But then you've got your kind of foundation year training 1, foundation 2. Generally, it's kind of a 3-year degree course, and then you're done. So as you can see, it's quite a few years after you finish your A-levels to become, you know, a GP. And that's then thinking about other programs, you know, becoming a surgeon and things like that, which take potentially up to sort of 16 years to train to become one of those. So do recommend, you know, looking into the Royal Colleges, just to kind of find out if you've got an idea, if you want to become a psychiatrist or if you want to become, you know, an anaesthetist. Just make sure you are looking on the Royal College websites, because they'll give a really, really clear idea of this is exactly how many years really it's going to take after you've done your A-levels and your extra training. Okay, so that's kind of how you physically become a doctor, and that's your kind of your basics on training. And one thing I do also like to point out as well, when I said there's sort of competition between sort of foundation trainings and things like that, there is a little bit of competition. So just make sure you're doing as well as you can at every single stage, and that's going to put you at the kind of top of the list when you go on to do your further training. It's going to kind of put you at a more advantageous point. So as I mentioned before, there's quite a few different course types, and what I'm going to talk you through is every single medical course isn't necessarily exactly the same. So when you apply to do a degree in medicine, you're not necessarily just applying to do one standard course. There's quite a few different ways of teaching. So kind of one of the first ways of doing it is a traditional medicine course. Now that's, you know, kind of think Oxbridge. That's the best thing I can kind of say. Think kind of preclinical and clinical years. So you kind of get your biology done, you do your biological teaching, your theory, and then what you do after that is your clinical experience. And they don't really sort of intertwine between the two. It's very much you learn things, then you put it into practice. You've then got problem-based learning, which is kind of like I wouldn't say polar opposite, but it's kind of the other way of doing things. You do things in groups. You get given a problem or something that you need to kind of work out. You work as a group, and you kind of come to those conclusions. It's very much kind of self-led. If you're interested in self-led sort of teaching and finding things out for yourself, rather than, you know, the idea of being spoon-fed is horrible to you, then something like a problem-based learning course is probably going to be for you. And then in the middle, if kind of neither of those options sound, you know, ideal for you, what I would just suggest is have a little look into integrated courses, because integrated courses essentially are an integration of both of them. So it's a really, really good idea to consider, okay, I want some clinical experience, but I also do want that kind of self-led teaching as well. Definitely consider things like the length of course. So looking at things like intercalation, looking at you know, a 4, a 5 or a 6 year course. Sorry, my printer's going mad. I don't know why. It's chosen the worst moment. It's been off all day. The length of the course. So you can do a 4, a 5 or a 6 year course. Now the 4 year option is usually for degree entry. So if you've done a biochemistry or a biomedical sciences degree first, you can then do a standard sort of 5 year course, which a lot of universities do offer. And then the 6 year courses sometimes tend to have they tend to be the more sort of preclinical, clinical, traditional courses. Now, when I mention intercalation, that's an opportunity for you to take some time out of your degree. Usually it's with the 5 year courses to kind of go do a research project and really kind of find an area of interest other than in medicine. And it's a really great way of kind of getting more points and again, giving you more of an advantageous position when it comes to foundation trainings. Sometimes we say foundation in a couple of different ways. Your foundation training, so your foundation years when you graduate, that's one thing, but we do sometimes offer, universities sometimes offer a foundation year. So this is a 6 year option, a different type of 6 year option, which give you a little bit of kind of assistance in the application process. So it gives you kind of, you know, an idea of, it might have different A-level entry requirements, it might be sort of having a widening participation criteria with geographical considerations of kind of where you live, what your school type is. So, you know, double check if you're eligible for one of those as well, because sometimes that might kind of help you in your journey to medicine. You know, they're not just necessarily for students that haven't achieved 3 A's at A-level and things like that. It's taking lots of other things into consideration. But my colleague Nicola from Lancaster will talk a little bit more about applications in a second. In terms of sort of which university you should choose then, I'm just going to sort of run through. These are the things that you really should be considering, what's important to you. So, you know, is early patient contact, is getting into hospitals from first year really important to you? And if it is, then you know, go through that. You're going to find the answers to all of these questions just by researching. This is all information that's available to you, and we don't make it difficult for you. We don't hide this information, and we just, you know, make it available on our websites. You know, think about where in the country, think about the size of the medical school as well. Do you want to be one of 120 or one of nearly 400 students? You know, these are all things that are very, very personal, so I can't suggest, you know, what is important and what isn't. This is just considering for you. Okay. Now, what the kind of things you'll be studying, obviously standard medicine, you are learning to be a doctor, so you're going to do clinical placements, okay? You are going to maybe go into surgical placements or children's health, pediatrics, things like that. You are going to learn things like suturing before you go and practice it, you know, looking at putting a catheter in. You're going to know this stuff before you go and put it into practice, okay? So this is really important. You know, you might do different placements in different courses, different clinical apprenticeships. These are all things that are going to, you know, completely shape your university experience and make you a better doctor by kind of considering all these different elements. So I've just got really quickly here a bit of a curriculum example. So could be that you really are looking at more of a sort of integrated course. Well, this is a kind of example of an integrated course. So what you might look at, so you're looking at your fundamentals, but you do medicine in practice. So you do get onto, you know, your clinical placements from first year, and then, you know, looking into progressions, into more of a focus, and then you can see the final sort of year, 2 years is really developing your clinical skills, and then finally preparing for independent practice, so preparing for that leap essentially into medicine. And this just gives you a little bit of a week in the life. So this is a kind of example of a weekly timetable on somebody doing a medicine degree, a kind of integrated medicine degree. As you can probably see from that, there's not a great amount of free time, especially on a Friday and a Monday. You don't look like you've got too much spare time. And you might find that as a medicine student, you know, there's not a great amount of time to go and join 70 societies and, you know, do all the things that you want to do, because really your degree choice, your medicine degree choice, that is your craft, that is what you're there to do. So, you know, there are medicine societies, so medsocs across all different universities, they all have them. So it's really important that you do sort of look into that as well. Just make sure as well, the final thing that I'll kind of leave it on is just make sure you can visit your choices. So just make sure that you are going along to open days. I realise at the moment it's very, very difficult to get to see universities, but we're all putting on sort of virtual open days. And as a medicine applicant, it is really important, you know, what are the facilities like? You know, are you going to be able to hopefully study there for a little while? So that's kind of an important thing. If you can get along to these virtual open days at the moment, really, really important. Okay, if you do have any sort of questions on that, I realise I sort of spoke relatively quickly. I sort of don't want to take away from anyone else's time, but do pop them in the Q&A box in the Zoom bar. And what I'm going to do now is hand over to my colleague from the University of Lancaster, and I'm going to get on and answer some of your questions if they haven't been answered already. Okay, thank you so much.
Thank you, Steph. That was brilliant. That timetable, I looked at Friday. Friday looks a very tough day. Thank you, Steph. That was I learned loads myself, so I'm sure people that are watching this have learned absolutely loads as well. So thank you very much for your time. That was excellent. What I'm going to do now is pass to our second speaker, which is Dr. Nicola Phillips. Nicola is joining us from Lancaster Medical School, which is part of Lancaster University. And Nicola's going to talk about applications in relation to medicine, given especially because as well as being a teaching fellow, Nicola is also an admissions tutor, so couldn't think of anyone better to speak to you about that process. So I'll pass to Nicola. Just before I do, just one quick shout out for the Q&A. We're having loads of questions, which is great, and we are working through them. Just in that first 15 minutes, we've answered over 10 questions already. So if you send questions, we are doing our best to answer them, and we'll get to you as soon as possible. But Nicola, I'll pass to you. Thank you very much.
Thanks, John. Hopefully you can see my screen now. Can I confirm that with you, John?
Yeah, Nicola, we can see your screen.
Lovely, perfect. Okay, right. So yeah, as John said, my name's Dr. Nicola Phillips. I'm an admissions tutor and also a teaching fellow at Lancaster Medical School. I teach mainly foundation year and first year students, and I'm also involved in lots of the admissions processes. So reviewing applications, interviewing students, and visiting colleges and schools to talk to potential applicants about our course and how to apply for it. So hopefully I'm going to give you a general introduction to applying to study medicine today. And I'm afraid that you're going to have lots of homework to do afterwards, because it can be quite complicated. So you'll probably, if you're already considering medicine, you probably have already started to do some research. And as Steph said, medicine is quite different to other degree courses. It's longer, you're training to enter into a profession, and therefore there are higher expectations on you of your behaviour and how you act. You're also going to be learning on the job quite a lot. So you'll be working with patients in the clinic when you learn your knowledge and your skills. And therefore medical schools are looking for a different set of skills to just academic ability when we consider potential applicants. So here I've got sort of a list about the general things that we're looking for. And so obviously you'll need to be academically able. Medicine is very competitive, and therefore we're looking for students who've achieved highly at GCSE and A-level or equivalent. But when you come to university, as Steph said, your timetable can be really packed. And so we need you to be motivated to study. You'll be learning on the job, in the clinic, writing up notes, and you'll also be having to study theory at the same time. And therefore we look for whether you're a conscientious person and whether you're a motivated student. But other things we look for, so here on this slide, I talk about insight. So insight into yourself and insight into how other people behave, and that you're a reflective person. And so you're able to reflect upon your strengths and your weaknesses and start to understand how to improve. And that you share values that we would expect a medical professional to have. So if you've not looked up the NHS core values, then I'd recommend that you have a look at those. And if you disagree with them, you probably don't want to work in the NHS. We're also looking for candidates who are, we say, well-rounded. So people who don't just spend all their time studying, that they have other interests, which means that they can relate to members of the public better. We want to find applicants who are resilient and can cope with studying different types of skills which they might not necessarily be good at to start with, but also that can cope with a profession which at times can be emotionally and physically draining. We also want to see whether candidates are thoughtful, caring and compassionate, so have the types of personality that we'd expect someone who's working in a caring profession should have. So because we're looking for so many different things, the admissions process for medicine is more complicated than it is for other degree courses. So we look at your UCAS application for your academic criteria. So those are the grades you've already achieved at GCSE or equivalent, plus your predicted grades at A level or any other qualifications that you've taken. And then we'll also look at a medical admissions test, and I'm going to talk you through differences between different medical schools in a moment. But then we also want to look at those non-academic criteria which contribute to whether or not you'll be an effective medical practitioner. And so to do that, we'll think about what you've done for your work experience. We might read your personal statement, which might be where you explain your work experience and your motivation for studying medicine. And we'll also try to assess some of these skills at interview. So these are the things that we assess. There's finally a step called fitness to practice that we check before you begin studying with us, and I'm going to briefly go over that. And then finally, at the end of this talk, I'm just going to give you some useful resources which hopefully will answer any other questions that you have, because there's lots of information, as Steph said, available for you online. Okay, so let's start with academic entry requirements. So these can be very different at different medical schools. I've said that you need to achieve highly at GCSE and A-level or equivalent, and that's because medicine is very competitive, so you're competing with other very able candidates. I've put up 4 different medical schools on the screen, and I've listed their GCSE and A-level requirements. If you are applying with different qualifications, usually universities will publish those qualifications on their websites, and if you find that the qualification that you have you're not sure of, the best thing to do is write directly to an admissions team at a medical school who'll be able to answer whether or not that qualification is eligible. So you can see on this screen that there are different requirements at GCSE and there are also different requirements at A-level. These are both in terms of grades and also in subjects. When you apply through UCAS, make sure you check the GCSE and A-level requirements of each medical school you're applying for. It's usually very strict when you apply because it's so competitive. So universities are very open with these criteria because they don't want you to waste an application because you've not met the minimum entry criteria. So Lancaster Medical School, we count up GCSEs on a points-based system, and as long as you achieve a certain number of points equivalent in your GCSEs, then you make it to our next step of our admission processes. Other universities will look at your GCSE scores and then count those up and then rank you based upon those GCSE scores. So different universities will use your GCSE grades in different ways, and it's important that you're aware of this before you make your application. The other thing to point out is I've just put up A-levels here, but some universities look at EPQs or additional AS levels. They might make their standard offer slightly lower. So at Lancaster, our standard offer is 3 A's at A-level, including 2 of chemistry, biology or psychology. But if you're offering an EPQ as well at grade B, you achieve a grade B, then we'll drop that grade down, that standard offer down to AAB. Other universities won't drop their standard offer, they won't lower it at all, but they will take your EPQ in consideration when they're ranking candidates. So it might give you an advantage over someone who isn't studying an EPQ. So again, check out from your favourite universities that you're going to apply to how they use different qualifications and what they do with those when they're assessing your application. So the next thing I want to talk about, so as Steph talking about foundation courses, other universities at the moment are offering contextually lowered offers. And so what we want to do is make sure that the medical profession represents the society that it's looking after. And so to attract people from a wider range of society, if people come from a background where there are barriers to enter into higher education, as I've listed on this screen here for eligibility criteria, you may be entitled to a contextually lowered offer. At point of application, your predicted grades will need to meet or be very close to the standard offer that the university is making. After interview, if the university is likely to make you an offer, they might offer you 2 offers, one your standard offer and then another contextually lowered offer. But you will need to meet certain eligibility criteria in order to qualify for this. So again, check out your short list of universities, and if you have any questions about their criteria, send them an email because the admissions team will be happy to answer it. Okay, so we look at your A levels or your qualifications, but actually we tend to get lots of applications from people who've all got very similar qualifications and they're all doing very well academically at school or college. So we use admissions tests as a way of differentiating between very able candidates. But again, different universities use medical admissions tests in different ways. So some will use it as part of their ranking process in order to determine who they're going to invite to interview. Others will use it in combination with GCSEs and your interview score to decide who to offer to. Some universities don't use a test at all, and others might use it just to differentiate between candidates who after interview lie very close on the ranking and they just want to decide who to offer a place to. Again, most universities will publish this information, so check it out before you apply. There are 2 different admissions tests that you can take, so the UCAT or the BMAT. Most medical schools offer or ask you to take the UCAT. There's a web link up here. There's a huge amount of information available on how to prepare for the UCAT online. And then Lancaster and other universities use the BMAT, the biomedical admissions test, which is a slightly different test. I want you to be aware, and lots of people have asked about this already, about what's happening because of the COVID-19 situation at the moment. So both UCAT and BMAT are publishing updates about where they stand with COVID-19. Because UCAT is taken in a test centre, so similar to where you take your driving theory test, it means that they'll be unable to offer the UCAT until those test centres are open. So at the moment, they've said you can't register to take the UCAT at the moment, but they advise that you should start prepping for it, and that they'll release some information about when you can register for it as soon as possible. BMAT at the moment are predicting that both their 2 test settings, so there's 2 times you can take the test for medical applications in the UK, in September or November. At the moment, they think that they're running ahead, but they're slightly unsure whether the September test date will occur because, again, that's taken in a test centre. The differences between the 2 tests, the UCAT is taken in a test centre and you take that on a computer, whereas the BMAT is a pen and paper test. There's different sections which are testing different skills, and they're testing quite different things actually, the 2 tests. Some students choose to take one or the other, and some students take both to kind of increase their chances of getting into university. One thing to note with the BMAT is it's a pen and paper test, and you take it at your school or college, or most schools and colleges will allow you to take it there, and you might register through your school or college if you're taking the test in November. There's loads of information about these tests online, but one thing to just note is that Oxford University doesn't accept the September date for the BMAT. They only accept the November date. So if you want to apply to Oxford, make sure you take the November date. The other universities who use the BMAT don't mind either the September or the November date. So how should you prep? So whenever I speak to students about prepping, there's often quite a lot of worry about these tests because they're seen as quite difficult things. They are tough, but remember, they're trying to differentiate between very able candidates. They're not expecting you to get 100% in these tests. People tend to get about 50%. Both these tests, I think, publish their results, the spread of results online, and they have a huge amount of free resources that you can use to help you prepare and revise for them. You don't need to pay for expensive courses to prep for these. Any courses that are available, usually just use the free resources available on their websites anyway, so you're just paying for someone to show you what those resources are. When you do prepare, make sure you familiarise yourself with the types of questions that are used first. Practice all sections of the test. Don't just practice the ones that you either find hardest or perhaps you find easiest because it makes you feel comfy. And make sure you practice under timed conditions, because that's the major thing which is tough with this, is that is getting the timing right and getting through the test. Okay, so now I'm going to briefly talk to you about the non-academic criteria for medicine. So that's work experience, personal statement and interview. So work experience, there's been a question already on the Q&A about what are our expectations now that COVID's happened and it's difficult to get work experience. Often students overestimate what we're looking for in work experience. We want to see that you've worked within a caring or service role with people, and particularly those who are ill and disabled or disadvantaged. But that doesn't necessarily mean a healthcare setting, although if you do manage to get some work experience in a healthcare setting, what I'd say that would do is give you some insight into what a career in medicine is like. And it's important that you gain that because you're choosing and committing yourself to a huge amount of study. And so it's important that you actually know whether or not you want to commit yourself to this. What we want to see is that you've got a realistic understanding of what it's like to be a doctor, that you can demonstrate some of the skills, or you can understand the types of skills that are required for a caring role, and that you have some of the attitudes and behaviours essential to being a doctor. Now, if you're worried about how to get work experience, the Medical Schools Council, I've popped up a link here and it's also in the Q&A. The Medical Schools Council have released a PDF which explains kind of what medical schools are looking for in work experience, and also kind of some COVID-19 guidelines about how things have changed. There's also a couple of links to some really nice online resources, one from the Royal College of GPs where you can get some actual virtual work experience, and also Brighton and Sussex University have made some online resources for work experience. So the links are within there. Take a look at those and try and get some online experience whilst you can't go out and get some physical work experience. Okay, so personal statement next. You might write up about what your work experience and kind of the skills and attributes relevant to medicine in your personal statement. Be aware that different medical schools use personal statements in different ways. Some of them won't look at your personal statement at all, apart from to kind of see that you're motivated, but they won't rank you based on it, whereas others will rank you based on your personal statement. So it's important that you take a look at that from their website. It's really important that you write your personal statement and that it's not heavily influenced by someone else, because we will talk to you about it at interview, and if it doesn't sound like you, it can seem quite strange. It should reflect you as a person, and it should be an honest reflection of you, your thoughts and your skills, not kind of full of cliches about what you think we want to hear, but actually what you think medicine is. Different universities look for different things in their personal statement. When you've decided what your shortlist is on your UCAS application, go to each of the universities you're applying to's webpage and look at the advice they give for their personal statement. Write down everything that they share in common and then any unique differences. Then make sure you understand whether or not you're going to be ranked by that university based on your personal statement or not. then you can kind of plan out the content of your personal statement and dependent on what those results are, but definitely compare them. But you can see from this slide, there's lots of commonality between them, but there are also some distinct differences. Okay, so I'll finally talk to you about interviews. So at interviews, this is where we're trying to look for all of those non-academic criteria that we can't assess in other ways. And so there are two different types of interview. The first is a panel interview where you will be sat in front of multiple interviewers who'll each ask you different questions, and then they'll be assessing you separately in that panel interview. Different interviews for panel interviews are set up in different ways. Sometimes you'll be with other candidates and sometimes you'll be on your own. Again, the university should explain that in their website, and so it's worth taking a look at how to prepare from their website before you go. Multiple mini interviews are a different kind of speed dating style of interview where you go round different stations and you're assessed by different people, and each station will probably look at different skills required to practice medicine. But also at Lancaster, we design our stations specifically to test the skills that we think are useful to study at Lancaster. So we're a problem-based learning course, and so we look for group work and problem-based learning in our interview. But we're looking for all of these different skills: communication, how you communicate with people, your values and attitudes, what your understanding of your career choices, and also your motivation to become a doctor at interview. Okay, so finally, fitness to practice. Fitness to practice is really looking at three different things, and it's a general medical council thing that we look at. The first is probity, which is your honesty and trustworthiness. The next is your health. And the final thing is your criminal record. I've not got time to go into too much detail about this. On our Lancaster, the web link I've got on this page here is to our admissions page on Lancaster, because we explain the different bits. But also for the health, and this link up here to HEOPS will be able to talk you through the different things which are considered. Fitness to practice. The health and criminal record part aren't taken into consideration until after we've offered you a place, and generally they're not an issue. It's just for us to make for health adjustments to make sure that you can study with us and that you're able to work in clinical practice. With your criminal record, there are some things which would prevent you from joining the medical profession, and so the key thing is to just be honest, because when you start medicine you will be DBS checked, and so if you haven't declared anything that comes up, then we will consider that you've not been honest, and then that comes back to probity. Okay, so just quickly some resources to look at. Entry requirements, take a look at the UCAS page, Steph was saying, and as also universities' web pages have tons of information on them. You can use those and also their brochures, often they're published online as well. And most universities are offering virtual open days, so you can still actually visit the university and get the types of talks you would have had if you were visiting in person. But one resource which is amazing and you definitely should check out is the Medical Schools Council web pages. So they offer advice about every single step of applying to medicine. And so if you go onto the studying or kind of advice for applicants pages, there's lots of PDFs and videos that you can download and take a look at, which I think you'll find really helpful. Okay, and so I'm going to sign off now. If you have any questions, pop them in the Q&A and Steph and I will answer them as best we can. Thank you very much for listening.
Thank you, Nicola. That was brilliant. Loads and loads of questions that have come as a result of the brilliant advice you've got. So I think you're going to have a busy 20 minutes. If I can now introduce our final speaker, certainly last but by no means least. This is going to be a really popular session as well, and it's looking at wider courses in health and social care. So if I can introduce, please, our next speaker, which is Hollie Thompson. Hollie, excuse me, reading, I'm just checking I'm going to say it right. Hollie is the Student Recruitment and Outreach Officer at the University of Gloucestershire, and she's going to talk to us about courses and careers in health and social care. So Hollie, if I can pass the floor to you, please.
Hi everyone, so yeah, I'm Hollie Thompson. I'm a Student Recruitment and Outreach Officer at the University of Gloucestershire, and one of my main roles is to support in the School of Health and Social Care. So let me just bring up my presentation. Great, so hopefully everyone should be able to see that.
Yeah, we've got that.
Oh, So my talk is going to kind of cover the courses that we offer at the University of Gloucestershire. I'm also going to talk a little bit about the types of careers that students will go on to after these courses. I'm also going to talk a little bit about interviews with our courses as well, and signpost you to some useful resources and some web pages that you can visit as well. So I thought I'd just start off by saying whereabouts are we in the world, because not everyone knows where the University of Gloucestershire is. So we are based in the heart of the Cotswolds, split across campuses in Cheltenham and in Gloucester. And we're just going to be talking about our campus in Gloucester, which is called Oxtalls, and this is where our School of Health and Social Care is based. And in this big white building you can see here is where the majority of our courses are taught and where all the facilities are based as well. So I'm just going to talk a little bit about our courses kind of in general, and then I'm going to focus in a little bit more on the types of courses, which are some of the kind of pathways that you can go into in health and social care, and think about the types of careers as well. So all of our courses are taught by really experienced staff. They've really been there and they've done that. So one day they might be teaching you at university, and the next day they're in a healthcare setting and they're treating patients. We have some really cool equipment and facilities as well. So we have a ward, which is a really versatile room that's used for lots of different parts of our courses. It's set up just like a hospital ward would be, and students can practice their bedside manner, they can practice doing observations on patients, and also doing sort of clinical skills as well. So a couple of months ago, I actually went along with some adult nursing students, and we were practicing how to do injections using kind of foam skin to practice on. All of our courses are super hands-on, lots of practical elements to them. So you'll have your theory lessons, and then you can go and practice what you've learnt in a practical way. So we do have these mannequins, as you can see, which are often used by our students. We also have this slightly different type of mannequin as well, which shows kind of the internal side of the human body. And this allows students to look at anatomy and physiology in a more like closer detail, specifically used by our physiotherapy students. We do also have some life cast body simulating mannequins, that's really hard to say, which are actually 3D modelled off of real people, and tell me they are really lifelike, trust me. We have some adults, and there's also some children and a baby as well, which are used by our students to practice patient treatment. Our practicals aren't just done at university though. We utilise what's called the Skill Zone, which is basically a massive warehouse in Gloucester, which is a mock village. So it has a courtroom, it has a house, it has an alleyway, and our students can go there, and it's basically a safe place to practice their approach to challenging situations, specifically with our social work students. We have actors come in, and they can just practice social work visits, for example, and really build up their confidence before they go out into the real world. We also have really great links to industry as well. So we will do sort of bigger scenarios. So we'll have individuals from different emergency services come onto our campus, and they'll do big scenarios where our paramedic science students will be the first responders at the situation, and then it will go all the way through to them passing over to our student nurses in our ward. And these links really allow us to offer some great placements, and you will find that placements are a really key part of health and social care courses in general. They allow students to go out and practice what they've learned at university, and this can be done across a wide variety of settings. So it really does depend what course you're studying, but this can be anywhere from a hospital to a care home to a homeless charity as well. And you'll find that as you go through your course, the amount of time spent on placement will increase, and you'll be given more responsibility as you go through. But there are lots of support given to students on placements as well. So you aren't just kind of left there by yourself. For example, on our nursing courses, we have what's called coaches in practice, and they go out and they support students on placements and can reassure and can support and answer any questions. So I'm just going to give you an overview of the types of courses that we offer, and this might just help for some of you to kind of figure out what course is what, because there are quite a few different types of qualifications within health and social care courses. So the typical 3-year degree, a BSc, so a Bachelor's in Science. There are also what's called Cert HEs, which are equivalent to like the first year of university. So this is like a level 4 qualification. There are some foundation degrees out there as well for health and social courses, and these are typically 2-year courses, so equivalent to 2 years at university. And then there are some top-up courses as well. So if you already have yourself a level 5 qualification, but you quite like to top it up to a level 6 or a sort of 3-year, then there are courses that offer that as well. It's also key to note as well that for some courses in health and social care, you'll find they do start in September, like lots of other degree subjects do, but there are also January start dates as well. So that might be something to have a look at when you're looking at courses, because that might change your mind about where you want to go. This just gives you an overview of all 14 courses that we offer. So this is just some of the examples of the types of courses you can offer that are offered at universities. Obviously there are more out there than the ones I've shown on here, and I would suggest that you have a bit more of a research into them if you sound like you are interested in some of these courses, or want to have a research into some of the other courses that are offered across universities in the UK. But I have just split them up based on their qualification type, just to try to make it a little bit clearer. But I am going to go through each of them in turn now, just give you a little bit of detail about them. I have also popped the entry requirements on the slide as well, but that isn't the extent of all the requirements for these courses, so I do advise that you go and have a look at them in more detail if you are interested. So our first course is a Health and Social Care Cert HE. So this course is really designed for anyone who doesn't quite meet the entry requirements for one of our 3-year courses. So this gives you a really good grounding and sort of builds on your knowledge about health and social care in general. And this course actually does guarantee you an interview on one of our health and social care courses as well. So it doesn't guarantee you a place, but does guarantee you an interview. We also have working with young people, children and families, which is another Cert HE. So again, this is designed it's got lower grade requirements and guarantees you an interview on one of our courses. It is a real great progression into our social work course, because it has a focus on making a difference in the lives of children, young people and families. Next up, we have our foundation degree. So this is nursing associate. So this is actually a fairly new role within healthcare, and nursing associates support nursing staff and healthcare workers in different health and social care settings. And they will support in doing clinical tasks, in taking observations, and also ensuring the privacy, dignity and safety of patients as well. We do have a leadership course in health and social care. It's one of those top-up courses, so it does require you to already have a foundation degree or equivalent. And this course is all about kind of learning all about leadership in all aspects of health and social care. And individuals that have done this course can go on to be care managers or health and social service managers as well. So I'm just going to touch on our nursing courses. So we have 3 different nursing courses at the University of Gloucestershire, but you will find there are other nursing courses that we don't offer. For example, children's nursing is one of them. Our nursing courses, like all of our other courses actually, have a really strong focus on culture of care. So that is all about ensuring that you care for yourself before you go out and care for other people. And courses in nursing can lead you on into careers in nursing, but also careers in potentially research or in education, such as teaching at university level, for example, or going on to be a nurse internationally as well. So yeah, this is our adult nursing course. We do also have a mental health nursing course as well. So this equips you with all the skills and the compassion that you would need to treat people with both mental health and also physical health needs as well. This is one of our new courses. This is subject to validation, so that does mean it's in its final stages of being approved. But really, a learning disabilities nursing course trains you in specialist healthcare, so relating to those with learning disabilities, as well as supporting their families and also other staff teams as well. And learning disability nurse, the kind of role of a learning disabilities nurse really involves maintaining and also treating mental and physical health needs of people with learning disabilities, as well as supporting them to live a really fulfilling life. Next up, we have our social work course. So this is one of our few courses that isn't actually taught in our campus in Gloucester. This is taught at our campus in Cheltenham. And there is another course as well that's taught at Yeovil College University Centre as well. So that's slightly different. So social workers are individuals who make differences in people's lives. So they help them through difficult times, potentially through crisis situations. They help safeguard people and also act as guides and advocates for people as well. We also offer a physiotherapy course as well. So a physiotherapist being someone who takes a whole person approach to treating people with illness, injury or disability. They look at giving advice, providing education, using movement and exercise to treat people. And those that study physiotherapy can go on to stay in sort of a general clinical career, so treating a variety of different patients, or you can specialise in different areas such as elderly care or rehabilitation as well. We do offer a top-up in paramedic science as well, so that is for anyone that has a level 5 qualification already. So quite a specific qualification to have to go on to do this top-up, but it can really help progress your career. We do offer a paramedic science course as well. So our paramedic science course mixes classroom with practical, and you utilise those mannequins that I spoke about earlier, the 3D ones that look really realistic. And also we use a simulation ambulance as well during our course with paramedic science. And paramedics are often those that are first on a scene, often in emergency and non-emergency situations. This is another one of our new courses in the School of Health and Social Care, and it might be a type of career that you hadn't thought of before. This is operating department practice. So operating department practitioners, or ODPs, they're really a vital part of the operating team. They work alongside surgeons and surgical staff to deliver safe and high quality care throughout the whole surgical procedure. And individuals who become ODPs can work within the NHS or within private healthcare facilities, or even go on to research or education as well. Right, this is our last course to talk about. This is diagnostic radiography, which again might not have been a type of course that you had considered before. This course utilises a new radiography suite that really mimics what you'd find in a real clinical setting, so what you might find at a hospital. And a diagnostic radiographer produces diagnostic images, so these can be used to assess illness and injury. And the course combines lots of different aspects of medicine, of sort of healthcare. So we're talking about anatomy and physiology, also physics and pathology as well. Okay, so those are all of the courses that we offer, and as I said, that is not the extent of all of the healthcare courses that are offered. I would suggest having a look at the NHS Healthcare Careers website. They're really great for giving you all of the different careers that are available healthcare-wise. You can do a sort of quiz as well that can show you what, based on your characteristics and your answers to certain questions, what you might be more suitable for, what you might be more interested in, which is quite interesting. I just wanted to touch on interviews for us as well. So all of our courses have an interview as part of the application process. And this just gives you an idea of what an interview would be like. So it has an introductory session about the course, as well as a tour of the facilities and the campus. You then have an observed group session. So this will be alongside your fellow interviewees. And then depending on the type of interview that it is, there might be a reflective exercise that follows on from your group session. And then there's an individual interview as well. So this will be with a lecturer, a professional in that area, as well as a service user, and also potentially current students as well. And if you do want to find out a bit more about those, I've just popped a link at the bottom there, which can give you a little bit more information about each of the types of interviews for each of the courses. I have written a few blogs as well, so these give you more general information. So if you want to know a little bit more about writing personal statements for health and social care, what we're looking for at the University of Gloucestershire, but in more generally what in general we're looking for in a personal statement. I've also written one about interview prep as well, so giving you some top tips about how to prepare for interviews as well. Cool, and in terms of what's next following this, if you do want to find out some more about our courses, I've obviously only taken kind of a very brief overview of our courses today. If you want to find out more, go to our website. If you type in the School of Health and Social Care, you'll be able to find out more information. We are running some virtual open days, as the other speakers have said. Lots of universities are offering these now as an alternative to on-campus ones. So we've got ours on the 7th of June and the 27th of June. So if you did want to find out more about our courses and speak to the lecturers that teach them and some students who go to the University of Gloucestershire as well, feel free to book on. If I don't get a chance to answer your questions today, or if you have questions for me or current students, you can actually ask them to us at glos.ac.uk/talk. Thank you very much. That's me finished.
Thank you, Hollie. Another great session. It was funny the way you were talking about different aspects, be it physiotherapy or anything else. A lot of questions were coming in and you're kind of answering the questions without seeing the Q&A. So thank you. Really good session as well. We are now about to run out of time. I'm conscious that people have been asking Hollie a lot of questions, but the event is going to finish at 4 o'clock, so we're not going to have time to answer them now. But one thing I will say to you is I won't have your contact details linked to your question. But if we've not answered one of your questions, if you email me after the session, my email address is just jonjon@unitasterdays.com. I'll make sure I get an answer for you. So I'll have a chat to Hollie for you, or Nicola, or Steph. And get an answer for you. We've had loads of questions, which is great because everyone's been interacting so much, but it then becomes a challenge for us all having to answer them in time. So Hollie, thank you very much. Right, just to round up, a massive thank you from me, please, to our speakers in order of when they presented. So starting with Steph Hartley from the University of Southampton, then Dr. Nicola Phillips from Lancaster University, and last but not least, Hollie Thompson from the University of Gloucestershire. In terms of our events in the future, we run these events every single Tuesday. So next Tuesday at 12 o'clock, I'm joined by the University of Essex, and then Hello Future, one of the UniConnect networks, and St Mary's University, Twickenham, looking at different aspects of university, be it the differences between school and university, student life, and choices that students are going to have ahead of them. So that's next week. We're also doing a subject special next week in engineering, which starts like this event at 3 o'clock. But in the nick of time, we're just approaching 4 o'clock. Again, a massive thank you to the speakers from me. If the technology behaved itself and we've got the recording and the speakers approve it, we'll get the recording up ASAP. Likewise, slides. If we can get the slides up on the unitasterdays.com/Tuesday site, we'll add those. So that's it from me. Thanks again. Hope you will stay safe. I hope this session's been really useful for you, and I'll see you all soon. Thank you very much.